I can remember in 1979 when we had the big oil crunch. Actually, it was earlier with the shortage, and you lined up.
Right.
Take you an hour to get in. So I was a resident, and I would wear my white lab coat, and they would see me and say, "Okay, doc, come on, come to the front of the line." And I think it was like a gallon back then.
Yeah. That was some of the perks of being a physician. That happened also during Hurricane Sandy with the gas out here on Long Island.
That was it. For people who don't remember those were the Carter years, and the children's and the homemakers, the wives, because my mom was lucky enough that my dad made enough money she could stay home if she wanted to. We had 2 cars, and so my dad would go off to work, and then the other car, mom and the kids would stand in line for hours at the gas station until you could fill it up, and then they would trade cars. That was a very different experience.
Yeah. So tell us a little bit about your day-to-day medical life in the office. What kind of cases did you see compared to what we have today?
So back then, a lot of infectious diseases. You have to remember that the vaccines like polio, DPT, and measles and mumps and rubella, they weren't widely accepted back then. Some of them were relatively new. I don't remember people saying no to them the way they do now. Well, I can tell you for myself, when I was a little kid, I was born in 1949. In the early 50s, my mother wouldn't take my brother and I to the pool during the summer because polio was rampant and we had the iron lungs. People were deathly afraid of it until polio vaccine came out. So it was lots of infectious diseases, otitis media, tonsillitis. I still remember giving IM injections of bicillin for a kid who had strep throat. I remember the last one I ever gave was in July of 78 because it hurt so much.
Yeah.
That was what you were seeing.
For those of you who've never given bicillin looks like milk. It's this white thing, and it hurts heck. Tough shot to take.
Remember those kids that used to have rheumatic heart disease that would come in once a month for the bicillin?
Yeah.
Back in those days, it was very little mental health. I don't think I even knew what autism was back in the 70s. Certainly, you weren't looking for treating depression and anxiety. Temper tantrums, you talk about toilet training. But with the illnesses, it really was infectious diseases and the asthmatics. Treating asthmatics back then was really difficult. You didn't have any of the meds that we do today, called the inhalers. I remember the first time trying to give a steroid, we had the something like Flonase, and we would put adapters on the Flonase bottle so kids could inhale it. Theophylline was the big thing, but you had to be careful. The theophylline toxicity, and I remember in the office doing theophylline levels in the office because you had a narrow range where you could be in. So we thought we were good then, and we had lots of things to help our patients. Doesn't compare to today, though.
Yeah, but even I guess with all these illnesses, acute illnesses, and no progress notes, I guess you could see what they would call 40, 50 patients a day, right? Back then.
I don't think I was seeing 40 or 50 patients back then a day. Certainly later on in my life, before I started taking people, and physically it was too demanding. Right. I couldn't do that. I wasn't putting it in a 7-hour day. I was putting in 10-hour days to see that many patients, which is why I said, okay, well, you better bring someone in with you.
And back to the asthma, did you give epinephrine shots for asthma?
We called it adrenaline. We called it adrenaline sub-Q back then.
It's awful. I had that as a kid. It's awful.
Yeah, but you had it as a kid, thank goodness, because if not, you might not have made it to the ED.
No, I know, but it was just awful. And then we did used to mix Decadron in the nebulizer and atropine in the nebulizer because there was no budesonide. And that was true until the late 80s, early 90s.
I can remember back in the 70s admitting asthmatics left and right to the hospital because there they would use continuous theophylline drips, not just the oral stuff like we give in the office. I can remember when I was chief resident, our director, the chairman of the department was really great. And he took one of the big rooms, because we still had wards back then. He converted it into an ICU unit for peds. We had someone who had done 2 years of peds and 2 years of anesthesiology. And he sent her down to Philadelphia. I don't remember the doctor's name, to train there to learn about an intensive care unit. And she came back and she ran this little 4-bed unit that we had.